Hi, Dr. Thayer here. I'm with a new patient, and she's not really new. She's been here 8 times. This will be her 8th visit today, 8th adjustment. She came in with right trigeminal neuralgia in her face, pain for the last 7 years. She was able to deal with it kind of off and on for the last 7 years, but in the last 4 months it's become constant and become pretty severe. She hasn't sought chiropractic care because she had some bad advice from her sister that had some bad chiropractic care in the past, that she didn't like it, so she has never go see a chiropractor. She's been to a neurologist for the trigeminal neuralgia. She's been to acupuncturist for it too. All of them say, don't see a chiropractor. Yeah. The only reason she came here is because this guy found me on YouTube and literally drug her in, forcing her in here. She had really the worst attitude when she came in here. She had the old like, I don't believe this shit, I'm here for my son. And within 1 visit, we changed her whole life around. She is like a budding chiropractic lover. She has now she refers everybody to us. She wants her sister that hated me to come in, and she's like, can I bring this person and this person? And so she loves it. So anyways, I want to get her story down. She needs translation. She speaks Spanish, so he's going to translate for us. Leonor, why are you here? Why'd you come?
¿Por qué estás aquí?
No, porque tenía un dolor en la cara. Se llama neuralgia del trigémino y era un dolor demasiado fuerte. Que no me dejaba ni comer, ni lavarme los dientes. Para hablar, hablaba una palabra o dos y me tenía que quedar callada porque sentía el calambre en la cara.
So she's here because of our trigeminal neuralgia. There'll be times where it'll be so painful that when she's talking, she'll be just getting 2 or 3 words out of her mouth, and then she'll just stop in the middle of a sentence, and she can't.
Yeah, I didn't know about the talking, but she also said the last couple of days I've been treating her 2 times a day. She says that when she used to open her mouth, just couldn't open her mouth.
Yeah.
It hurt.
Yeah,
right?
she couldn't eat or anything.
Couldn't eat like that.
Brush her teeth.
Brush her teeth.
Yeah.
And that it's getting worse over the years. So I didn't realize about the talking. So she's here for that. And what have you done for treatment?
¿Qué has sido por el tratamiento?
¿O cómo me ha pasado? Muy bien.
No,
not my treatment. I know you love me, but all the stuff you did before we came sorry.
Fui a México, ¿verdad? Me hicieron un MRI en la cabeza, me dijeron que era neuralgia, me dieron pastillas, no se me quitó.
So después to Mexico, they told her, or they did an MRI on her, and they said that it was neuralgia, the trigeminal neuralgia. They pretty much gave her pills.
Pills in Mexico? Pills,
yeah.
Okay.
Después estuve yendo con acupuntura, he ido como unas 10, 12 veces, ¿verdad?
Acupuncture is 10 to 12 times.
Y se me quita, una vez se me quitó como por 2 años, pero después ya iba 10 veces y ya no se me quitaba.
So she's gone to the acupuncture, and it'll stay off for like about 2 years, and after that it came back.
Gotcha.
Después, ¿verdad?
So that's good. Acupuncture helped for a couple of years, right?
Estoy yendo con un neurólogo y lo único que me dio fue unas pastillas, pero esas pastillas no me quitaban el dolor.
So she's gone to a neurologist, pretty much just sent her home with some pills, and that's pretty much about it.
So did she go to an acupuncturist for this last episode, the last 4 months?
Por los últimos 4 veces ha ido a
sí, hace como mes y medio fue la última vez que fue.
A month and a half is the last time she went.
So she went a long time ago and the acupuncturist helped. This last time she went didn't help. So that's why they ended up bringing her here, right?
Yeah.
Good. So I'm glad they came here. I'm glad she has a new understanding about chiropractic. I think I want you guys to watch this all going on. The biggest thing for her is that she was a complete disbeliever, completely did not want to come in here. Again, we pulled her in, dragging, screaming, kicking, did not want to come in, and she's doing better. How much better are you doing now, ma'am?
¿Cuánto más?
No, pues me siento contenta. Yo pensé que un 95% bien, ¿verdad? Y le doy gracias a Dios en primer lugar y al doctor, ¿verdad? Que es una maravilla, es una eminencia.
So she feels about 95% better, and she thanks God and she thanks you for this.
Well, that's nice.
I'm happy.
Yeah,
she's very happy.
Contenta.
Now she speaks English, huh?
Nice. A couple of funny things here is that, again, we drug her in here, didn't want to come here. Within 1 visit, she's bringing us presents. She brought me and my wife presents. We thought that was kind of funny. It's like, well, here, love you. I'm like, wow.
Es que estoy contenta.
Santa Claus in February.
Santa Claus in February. I thought that was funny. And so from like this to like, ah. And then the other thing, too, is that I don't speak Spanish that well. I've never heard her talk so much. She talks a lot more than I thought.
Yeah, no, that's the problem. We can't make her shut up.
I know. I'm asking that. I'm like, I didn't know she talked so much. So anyways, I'm sure all the stuff was nicely said. Thank you for translating. Anything else you want to say, ma'am?
Algo más.
Pues, muchas gracias,
Yes, no, you're doing great. Yeah.
gracias y mil veces gracias.
Perfect. So let's watch adjustment. What have we treated on you the whole time?
Algo quiero decir.
She wants to say something.
Sí, pues recomiendo a toda la gente que mire este video, ¿verdad? Que pues yo pasé por dolores fuertes y si ven ese video, venga con el doctor, ¿verdad? Él los va a curar.
So she's saying, now she's kissing ass. Oh, just kidding. She's saying, whoever's watching this video, do come with you. She's had a tremendous amount of pain. To the, it was just really painful for her, and I remember, from firsthand that how her expression would be when she would get those little attacks. Yeah.
Good. And she liked it so much, she changed so much that he brought her down, and then she ended up staying down here in a hotel.
Yeah.
Coming on her own, which she never would even step foot of the house before to come to a chiropractor. Yeah. So
this lady never misses work. So I mean, for her to do that, it's
huge.
You could ask her too.
Yeah.
She's a workaholic.
She's a workaholic.
Yeah.
So,
yeah.
Anyways, we really love having her here. I'm glad we weren't going to do testimonial on her at first. I just did it because they're like, let's get her on camera. I'm like, sure, let's get her on camera. So I'm glad we got her on camera. She's a wonderful lady. I'm glad to be of help. 7 years of pain, gone in a couple visits. So we love to see that. Let's get you adjusted, okay?
Okay.
Go on, first.
You fix your soul too.
Soul.
You fixed your soul. I said she's a happier person now.
Oh, her soul, really? Scoot down a little bit.
Okay, más abajo.
Good. Oh yeah, so what have I treated on you?
¿Qué te ha hecho el doctor?
Como el tratamiento.
Oh, pues, ¿cómo me siento?
No. ¿Qué te ha hecho? ¿Qué te ha tocado?
Have I touched
El cuello, todo
No
eso.
Anything else?
No, y acá los hombros, el cuello.
Yeah. Anything else?
Ah,
No.
No. Nothing.
¿Qué? No.
Yeah. Good. Okay. I got her sweating. She's not used to being on camera. Good. Okay, relájate. Okay. Good. Okay. This side?
yeah.
No, baby.
Mm-hmm.
Keep going.
Yeah. Yeah, I think she's more nervous from being on camera than getting the adjustment now.
I think so.
Beautiful.
Wow.
Yeah, much better. Okay. So, that is her story. Trigeminal neuralgia, normally you can't treat any other way except not treating it, but chiropractic can. So, take it for what it's worth. Hope it helps some people out there. Thanks for watching. See you guys next time.